question and answer section of the webinar will occur at the end of the presentation. So we really encourage you to share with us. Use the chat function to let us know what questions you may have. And at the end of the presentation, we will discuss them with Denise. And last but not least, if you find that your audio component is experiencing any technical difficulties, or you prefer to call instead, please switch from audio to phone call in the control panel. You'll be given a phone number and access code to dial in and listen to the webinar. So once again, thank you so much for joining us today. The subject of today's presentation we're very excited about. Today's webinar is titled Improving Health Insurance Literacy Among Connecticut Residents. As I mentioned before, I'm Evelyn Mantilla and I will be your moderator for today. Our presenter is Denise Octavia Smith, who is a research and associate project manager at the Yukon Health Disparities Institute. Denise, welcome to today's webinar. We really appreciate you taking the time to share your great information with our participants. So with that, if you don't mind, I'll hand it right over to you for your slides, and do let us know when you want us to move them along, okay?
Okay, certainly. Good morning, everyone. Evelyn, Access Health, Grossman Hines, thank you all for the introduction and the opportunity to present today. I want to welcome you on behalf of the Yukon Health Disparities Institute to this webinar on improving health insurance literacy for Connecticut adults. HDI, if you're not familiar, was created under state statute in 2011. We are here to address root causes of health disparities and take ideas that are known to work and turn them into policy and action. And I would just summarize the areas of our work in 3 ways: we connect, support, and serve. Next slide, please. Yeah, that's me. Good morning, everybody. Most of my work for the last decade or so has been around community capacity building and community engaged research, mostly prevention. And then more recently, many of you may have known me because you may have worked alongside of me during the first open enrollment in 2013 through the Navigator and In-Person Assister program. So I want to give a shout out to everyone. I'm sure many of whom are friends or colleagues. Thank you for joining us today. Okay, next slide. So wanted to kick off the webinar with a definition. It's great for us to be on the same page, and I'm going to be referring to this throughout the webinar. As you're reading the slide, I want you just to pay attention to those letters that are in red and underlined, the degree to which individuals have knowledge and ability and confidence to find, evaluate information about health plans, select the best plan, considering both their financial and their health circumstances in using the plan once enrolled. This definition was summarized back in 2012 at a roundtable. This was just before the marketplaces around the country began to open up in 2013. And I want to emphasize a couple of things. One, that health insurance literacy in terms of really understanding best practice to improve individual and community health insurance literacy is still relatively a new science. And I'd also like to point out quickly, but this will be a theme throughout, I truly believe it takes a village to improve health insurance literacy. This definition focuses on individuals' knowledge, ability, and confidence. But as I'm sure many of you are aware through experience and knowledge, that health insurance literacy, as all literacy, is developed, maintained, and improved in societal and cultural context. It's the way in which people acquire the literacy and how they maintain that through regular or frequent use when they're actually navigating health systems or trying to access health services. This is not something that we want to burden individuals with, but of course it would be wonderful and it's great to have an aim to make sure that each individual has improved their health insurance literacy over time. So why does health insurance literacy matter? I want to offer in the next couple of slides 3 key reasons why I think everyone in our state needs health insurance literacy. These are certainly high level, but hopefully they'll speak to all of our residents. Next slide, please. So the first reason I want to lift up, I'm using an acronym HIL for health insurance literacy. The first reason is that health insurance literacy intersects with health literacy. The slide that is before you right now is data from 2003. It represents the first large-scale national assessment on health literacy using 28 different health-related questions. But I'm presenting it to you today because it sheds light on the relationship between health literacy and health insurance coverage. As you see across the bottom of the screen, this assessment uses 4 different levels to measure health literacy: below basic, basic, intermediate, and proficient. An example of below basic level of health literacy would be perhaps that a person was unable to read 2 or 3 sentences, short instructions to figure out if they can eat or what they can eat or drink before a medical test. So that would be a common set of instructions that people might receive. The slide before you looks at the percentage of adults in each health literacy level by the type of insurance coverage that they carry. And this is where I think the slide is revealing and relevant to us. You can see that dark purple color that is circled in red represents the largest percentage of people who have below basic health literacy, and those all represent our uninsured individuals throughout the nation or those with Medicare or Medicaid. So we can begin to think already when you're thinking about the populations and the communities and families that you're serving, how many of them fall into these categories, and that this national assessment reveals below basic health literacy. Okay, next slide, please. Yes, so first we're going to run some tests to see how your insurance reacts. Wanted to bring a little levity to what is a very serious and complex set of concepts here when we're talking about health insurance literacy. And I wanted to also present this quote: health literacy, according to Philip Massey from the School of Public Health, is incomplete without considering health insurance literacy. So for all of you or for colleagues that you know of who are working in health literacy programs across our state, we want to emphasize the importance of this tool, health insurance literacy, helping people to understand what their coverage allows and what it doesn't. This is knowledge that Mr. Massey says even the most literate of Americans lack. And how can we begin to expect people to begin to access services if they don't even know what it is they have access to? Next slide, please. Thank you. So the second reason I want to lift up for you why health insurance literacy matters is that it helps to facilitate access to health care. I want to present to you some national data up top that 1 in 10 uninsured went without needed care due to cost. That could be because of their own family situation in terms of their own economy or wages, but it could also be because people are unaware as the next bullet shows, that people are unaware of what they're even eligible for. The next slide said that 68% of uninsured children, they're eligible for Medicaid, but they are not yet enrolled. In Connecticut, we know that there are residents right now in our state who are not aware of their eligibility for Husky Medicaid or for financial help through the Access Health CT Marketplace, which can greatly reduce the cost of their monthly premiums. In 2015, 36% of qualified health plan enrollees had not used their health insurance at all. So people might be enrolling. They might have that incentive and that awareness that a deadline is approaching and they need to enroll before the deadline, but may not really understand the value and the point of enrollment and receiving a health insurance card. We want those 36% of people who are currently enrolled to begin to access health services and understand all that is available when they're insured. In 2016, 33% of Hispanic residents didn't have a personal doctor. And for all of our Connecticut residents, again, having health insurance gives you that opportunity. Having health care coverage through Husky Medicaid gives you that opportunity to begin to develop a relationship with a regular doctor, to share in your decision making and get the type of care you need when you need it. Next slide, please. So the third reason I want to just lift up for you is that health insurance literacy helps protect against the financial effects of illness. Really like this picture, again, another levity in what is a very complex set of conversations that we're having today. She says, I wish my health insurance coverage covered the sick feeling I get every time I pay a doctor bill. Health insurance literacy does help people to really understand the cost of medications and doctor visits and how to apply those costs to their overall budget. It helps increase awareness of free or low cost essential health benefits. Essential health benefits are that set of 10 different categories of free or very low cost services, initially included and promoted under the Affordable Care Act, and most recently through the Connecticut state legislature, these essential health benefits were protected. And these are really tests and screenings that people can access at free or very low cost to detect or prevent illness. But if people are unaware of them, they may not be accessing these services. And the result is that people could be burdened with sickness or chronic disease because they were unable to receive these detection services or these screenings. Health insurance literacy helps build knowledge and skills to help manage the overall financial responsibility. So, of course, there may be individuals who can read and memorize a definition, what is a copay, what is a premium, what is a deductible, but may not really understand how those terms are actually utilized or how they come to fruition in real time when the copay has to interact with the out-of-pocket maximum or coinsurance. So when you get into the complexity of these concepts and how they're used and how they're applied when people access services, this is where people can, have resulting medical debt. And so we want to build people's knowledge and skills so that they can manage and really understand their financial responsibility. I want to stop here and just say for those people who don't have out-of-pocket costs, who don't have a premium, who don't have a copay or deductible associated with their healthcare coverage, there are additional costs that are not financial that can be associated with low health insurance literacy. That can include not seeking care when it's needed, the inability to understand instructions, as we gleaned from the earlier slide around health literacy, missed days of work, added transportation costs to and from medical providers due to a prolonged illness. So everyone can incur a cost from low health insurance literacy that is not necessarily financial. Next slide, please. So here's a great example of just to reinforce that everyone in our state needs health insurance literacy. This is one excerpt of a bit of research that was shared at one of the seminars that we presented back in 2017. A gentleman named George Lowenstein from Carnegie Mellon came to Connecticut and shared some of his research on what people say they understand about health insurance literacy concepts and what they actually understand. And so the slide before you represents those blue bars of what people claimed to understand when you were asking them about the deductible, the copay, coinsurance, or out-of-pocket costs, and what they actually understood when their knowledge was tested. This should be a severe warning for all of us that we want to increase our health insurance literacy within our families and community members because generally speaking, people think they know more than they do. Okay, I want to shift gears for the next couple of slides to just share with you some of the research and early learning that the Health Disparities Institute is elevating in the state of Connecticut around health insurance literacy. Next slide, please. So some of you may have participated in the Access Health webinar back in May. Dr. Victor Villagra, who's the Associate Director of the Health Disparities Institute where I work, shared a lot of our research and early learning. So I'm just going to present 3 slides today, but I encourage you to visit our website if you'd like to read this full brief. I have a picture of it here so you know what to look for when you go on our website. Back in 2016, Yukon Health Disparities Institute partnered with Access Health Connecticut to conduct a survey using 13 questions with 516 adults who had enrolled in a qualified health plan through the Access Health marketplace. And so let's look at some high-level results from that survey and from the 13 questions that were asked. The average Connecticut score from those 516 individuals was a D minus, technically 62.4%. When we looked at that average score of the 13 questions and the responses that people gave us, whites in our state who participated in the survey scored an average of 10 points higher, 73.8% on those 13 questions. Blacks about 10% lower than the average Connecticut score, and Hispanics about 12.1% lower than the average score, which was already a D minus. When we look at the average score by language preference, and we did offer the survey in English and in Spanish, the average score for English speakers or English responders of our survey was 80%, and those who preferred to take the survey in Spanish, their average score was just 50%. Next slide, please. So I mentioned in the previous slide that there were 13 questions that were asked. These questions came from the Kaiser National Survey that was done in 2014, and then a few of the questions were also brought in from the work of Catherine Paez and the American Institute of Research. But what's important to see here is that from our 13 question survey, we found that Connecticut adults struggled with both knowledge kind of questions and use kind of questions. And I want to give you just a very simple example so that you understand. And this is just an excerpt of a larger table. I couldn't include all of the 13 questions here, or else it would have been, you would not be able to read it. But I've highlighted for you in yellow examples of simple knowledge questions. So in our survey, people would be asked to define a word, and they would be given 4 options, A, B, C, and D, of which only one definition was correct. And then we also asked some use questions. So we took some of that, some of the most basic language, copays, deductibles, appeals, etc. We took some of that language from health insurance, and we asked people to use it or to really answer the question correctly when we were considering a scenario of how those words would be used when accessing health services. And so I've circled for you in red some of the results. Question number 3 is an example of a knowledge question. Question number 4, an example of a use question. And you can see the disparity in the responses. So the first column, the black bold numbers represent the aggregate. So when we take everyone's answers and find out what their score was, and you can see for that knowledge question, number 3, the score was a 64%, almost actually 21% higher for whites who answered the same question, and almost 20 and 22 points lower when blacks and Hispanics answered that question. Look at the percentage for our Spanish respondents of the same definition for an annual health insurance deductible. It's nearly 30 points lower than the average score. Question number 4, we can see from the all column, that black bolded number, that everyone struggled to answer this question, which is a scenario using both copay and a deductible for a hospital visit. The average score was just 31%. Even with that low score, white scored 13% higher on this question, and black and Hispanic respondents and Spanish survey respondents scored 10 to 20, 25 points lower on this question. So it helps to make you think about the clients that you're serving, the community that you're serving, and what we're finding in terms of people struggling with both knowledge and use questions. Next slide, please. So this is the final slide that I want to share, just to lift up some of the research that was conducted in 2016, and from the report I mentioned earlier that we released in 2017. We did find through our research that health insurance literacy, there were racial, ethnic, and educational disparities in our state. This graph shows 2 sets of bars. The bars in red in the back represent those people who took our survey who had a bachelor's degree or higher, and we did have some people in our survey with graduate degrees. And then the blue bars in front represent those respondents, white, black, and Hispanic, who had just a high school diploma. Now, if you look over at the far left, you can see the first blue bar. It has a 49 over it. That represents the average score of whites who took our survey who have a high school diploma. And the red bar directly behind it represents those whites who had a bachelor's degree or higher. And this is what we might expect, that people who have advanced degrees, who've gone to college, generally speaking, are better able to define words and use those words in various scenarios, better able to use their health insurance and get correct scores on a survey like this. But when we look across the race and ethnic categories, we see the disparity. So looking at that same blue bar with the 49 above it, whites with a high school diploma scored 49% average on our survey. Blacks and Hispanics with a graduate degree or higher scored 6 or 8% lower than whites who only had a high school diploma. And I just want to emphasize, this is obviously not to blame the race or ethnicity of a person on their ability to acquire health insurance literacy, but it does speak to the way in which this knowledge is transferred through community and in community. If you stop and think about it, there is no place on a college campus, in a high school, in a health system where you can go and take a course or a series of courses to master the concepts that are contained in health insurance literacy. People who have more difficulty accessing the health system, generally speaking, those are more likely to be Black and Hispanic residents. It may be the fact that they are not using the health system as frequently as whites that points to the reason why these scores are lower. We're not sure yet, but it's something that we're exploring, and it's something for you to consider as you prepare to help people enroll. Next slide, please. So after this research and this report was released, the Health Disparities Institute, with generous funding from the Connecticut Health Foundation, took this research and these findings and began to share them with our statewide partners to eventually form the Equal Coverage to Care Coalition. Some of you on the call may be members and participants in the coalition. So I want to give a shout out and great thanks to you for lending your time and your talent to this work. The coalition represents state agencies, patient advocacy groups, our federally qualified health centers through CHC Act, Access Health Connecticut, Health Insurance Company, Connecticut, many of our community partners, Please excuse me if you hear the background sirens. Our office is right next to the firehouse. But all of these organizations around the state, mental health boards and others, came together around three goals: to increase health insurance literacy, improve navigation support when people are using their health insurance and accessing health services, and looking to identify policy levers to simplify the complexity that is embedded in health insurance itself. We've conducted several meetings and seminars over the last year internally in the coalition, and also bringing in national experts so that we could learn and develop our strategies and to develop a curriculum. And what we really did was leverage the expertise of the coalition members to ask them, what do we think would represent a comprehensive set of learning objectives for people to increase their knowledge and ability to use their health insurance and get the most value out of their insurance to improve their overall health and the health of their family. Through the development of that curriculum, we issued mini grants to a few of our coalition members who provide direct service in community. That funding as well came from the Connecticut Health Foundation, and we're gathering that data to learn. This is both survey data, so the same 13-question survey that I mentioned earlier, we're using as a pre- and post-test for this community workbook, and we're also conducting focus groups to glean from people, what do we need to change, and how is our approach to teaching you about health insurance literacy, what worked, and what can we do better. Next slide, please. So here's a summary of what people said they wanted to learn, or what our coalition members said that we should teach. And I'm not going to read the entire slide, but you can imagine these concepts about the appeals process, how different policies interact if you have, two different forms of health insurance coverage for you and your spouse or your partner, what to say when you call the insurance company. So people really asked for the basics to increase their health insurance literacy. Next slide, please. And here is a list of what we brought together in our workshop. So again, I want to thank the coalition members for lending their time and talent. This is just a high-level summary. You will hear more, and I'll talk about that in a minute, if you attend the Access Health Conference on October 19th, when Dr. Villagra will actually be presenting a workshop to participants to increase your health insurance literacy and your ability to help your clients and community members. But as you're reading this slide, I want to point out we did respond to the request from people to learn the basics, why health insurance matters, picking a plan based on your family and your budget and your health needs. But we also wanted to address the navigation of using health services and how your health insurance interacts. We promoted choosing wisely, questions to ask your doctor so that people could improve their shared decision making and understand how care relates to cost. We were promoting knowledge of your rights when you have problems with enrollment or getting care or paying your bills, and where you can go, what resources, what people, what state agencies are available to help you if you need to file an appeal or a grievance. In short, we really wanted to increase the capacity of individuals to understand that they have rights, that there are people there to help them, and that people can be their own advocate. Next slide, please. So we conducted a series of workshops around the state through a series of select coalition members that I mentioned earlier who received grants from the coalition. All of these demonstration projects around the state were led by community health workers, and they were conducted in English, Spanish, or Haitian Creole. And here is some of the early learning. Obviously, this is the qualitative responses that we received in focus groups. We'll be sharing much more of the survey results with you very soon with the entire state because we really want to understand what works to increase health insurance literacy, and that's what we were testing. But here's what people said after a couple of months of having taken the workshop session and then coming back to a focus group. People said they learned to speak up and ask questions. people said they learned what to do when an insurance company says no, that they didn't feel powerless any longer and that they could actually seek help. They learn to call the pharmacy and get a list of medications they're taking and ask questions like how much they cost. One respondent said, I became more confident and now I want to help others. This comment really refers back to the earlier slide around the health insurance literacy definition. Health insurance literacy is gained, it's maintained, it's increased in social and cultural contexts. It takes the health insurance plan, Access Health Connecticut, those who are helping to enroll, whether you're a certified application counselor or a broker, community partners, health providers, and other community members or advocates to really help increase HIL in the community and help to maintain it. So now I want to shift gears because I know many of you are thinking about the next open enrollment, which kicks off in November. I'm sure some of you are preparing to become certified or you're considering what you did last year to help people enroll. And so I want to leave you with just a couple of strategies to help you or your organization be prepared to assist other people to enroll in the right plan, to re-enroll, to change plans if needed, for folks who are switching from Medicaid to a qualified health plan, or just wherever they are, if they like their plan but feel like they're not getting the most value, how can we begin to help those folks? And before I move to the next slide, I just want to say, I know that I have shared a lot here. It is impossible to expect that people have captured all of it, and it's impossible to think that people would become an expert from this brief set of slides. But I really just want you to have a sense of what kind of questions to ask, where to go for help, to understand that there are people who can help you help others to enroll and get the most value out of their insurance. Next slide, please. So the first thing we want to think about with the open enrollment season is preparation. And I think if you heard earlier Evelyn say we had to kind of switch slides, there are a couple bullet points or a couple of items that I wanted to share that are not in the Access Health deck that you see before you. So please connect to this deck or the recorded webinar to hear some of the additional things that I'm going to share. I see 3 listed, but I'm going to share some others. So I want to make you aware of an excellent resource that was updated in February 2014 from Connecticut Voices. This is the Husky Eligibility Manual. If you're enrolling people and you're helping people to understand Medicaid or Husky coverage, you need to have this manual. You can download it and the website is available there. Also, I want to offer to you the Know Your Rights pamphlet created by the Office of the Healthcare Advocate. I've given you the website there. This is another fantastic resource that helps people to really understand health insurance terms, determine their choices for healthcare coverage, and also selecting a provider, as well as to understand the cost of healthcare plans, how HMOs and PPOs are different, and many other things that you can consider. So this is another excellent resource that you should review to prepare yourself to help others to enroll and get the most value out of their insurance or their healthcare coverage once they have it. I want to mention that next week, the Health Disparities Institute is hosting our 3rd Health Insurance Simplification Seminar. This will be at 400 Farmington Avenue, and you can find more information and register on our website. But we've said throughout this webinar that health insurance is unnecessarily complex and that it can be a source of health disparities, as we saw in earlier slides. It can hurt some of the most vulnerable people, and it can also hurt our pocketbooks and ultimately impact our health outcomes. So Victor, along with other guests, are going to be talking about what the Connecticut industry is doing to simplify health insurance and make it easier for people to use use their insurance to access health services. And also, we're going to talk about how people can really get the most value out of their benefits and reduce their financial risk. And finally, we'll be covering the government's role, the state's role in protecting consumers' rights when conflicts do arise. Two more things I just want to point out. On October 3rd, the Connecticut Voices is hosting their Covering Kids and Families. This will be an important session for you to attend if you want to get up on Husky, updates on open enrollment, and a look at oral health and its relationship to the Husky plans. Also, a little bit of look into health policy and what's ahead at the federal and state level. So there are some great opportunities for you to start to prepare now in these next couple of months. Next slide, please. The next thing I want to lift up is in your strategy to get ready to assist others is developing strong partnerships. At the Access Health CT conference on October 19th, please take an opportunity to get to know the local certified application counselors, those people who are certified through the marketplace to conduct enrollment through the portal. Get educated. Sign up for the HDI workshop that Dr. Villagra is going to be hosting so that you can build your skills as a CAC or community partner to improve the HIL of your community. Also, I'll give a little heads up now, and you can certainly reach out to me for more information. But CHC ACT is launching the second year of their AmeriCorps Stitch program, and this program trains AmeriCorps members to come out and conduct health insurance literacy sessions only. There's no enrollment involved, but they're going to walk people through the CMS Coverage to Care tool that many of you are maybe familiar with, and also help refer you to community services that are available at the FQHCs around the state. Next slide, please. Okay, and then finally, just reminding you of some strong messaging and why we think everyone in our state should improve their HIL. It helps people to understand their eligibility, remembering that many people don't know that they're eligible for Husky or for assistance through Access Health to help pay their premium. It helps people to select a plan based on their family, their health, and their budget needs, and all of those things should be covered under health insurance literacy. It helps people to understand what your plan covers, promoting the free or low-cost essential health benefits, and just helping people to avoid unnecessarily high medical bills by helping them to understand their financial responsibility. We want to help people to get healthy and stay healthy, and we know that health insurance literacy is an important tool in that journey. That's my presentation today. I want to thank everyone, and I want to turn it over now to Evelyn Mantilla.
Thank you. Thank you so much, Denise. That was a terrific presentation. Let me remind the participants that we will have a question and answer session at the end of today's webinar. So I really want to encourage you to use the chat functionality and type up any questions that you may have, and we will consider them for answering as part of the webinar. I'm going to now share with you a little bit of more information on behalf of Access Health Connecticut. And that's because we are always looking for great opportunities to partner with folks that help us reach the populations that most need to be reached, and for whom we can also provide value to the work that they do. As part of the Access Health Connecticut outreach efforts, we have established a number of ways to contact us and to get information. So in this slide, for example, we have what I personally consider my favorite resource, and that's the community website. If you check us out at learn.accesshealthct.com/community, in that website, you will see a plethora of information about what Access Health Connecticut is up to in reaching the communities that we want to reach. You will also be able to view any of the webinars, including this one, This webinar is being recorded, and it will be made available for anyone through the community website that you see listed here. You can also see things like copies of our published materials that have a great deal of information to help you in your work. You can download and print these materials for use in your contact with your clients. And so overall, it's a really great resource of information. You can also search for in-person help, which we know to many of the communities that we have identified we need to reach the most. It is very important to be able to sit down with a certified individual that can help them through the process. If you go to support.accesshealthct.com, you'll be able to search for in-person help that will be made available across the state. We also have our community newsletter. It's published monthly. It's very informative, and we have heard feedback that people find it really helpful. Sign up today. The link is listed right here in this slide. And of course, the educational webinars, which we are participating in one of them right now. Don't forget that if you go to the community website, learn.accesshealthct.com/community, you will be able to get access to all of the same information. Sign up for our newsletter, check out the past webinars, and things like that. So once again, let me remind you that if you have any questions, use the chat box, and in a moment we'll get to them. Excuse me. We are also, as Access Health Connecticut, looking for community events that we can attend. You may have already seen us at some community events across the state where we strive to bring information to the community, to raise awareness about the need for health insurance, to answer folks' questions that they may have along the way. And so the best way to reach us, if you have an event or know of an event that you would like to suggest, is email us at this email address, outreach@accesshealthct.com. Or you can also fill out the form that, once again, in the community website is available to you. We are very excited about the 2018 Community Conference. Denise mentioned it a couple of times, and we really appreciate her lifting that information up to everyone, because it's a very informative, exciting conference, and it's a great way to get ready for open enrollment. Friday, October 19th, make sure you save that date in your calendar. It will be held at the Red Lion Hotel in Cromwell, and you can RSVP at the Eventbrite link that you see here. I believe it's also listed on the community website, so if you go there, you're able to sign up. So we look forward to seeing you there. Best ways to reach us. You are essentially talking to and listening from the outreach team for Access Health Connecticut. And you can reach us directly through this number, 860-327-5517. You can also email us at outreach@accesshealthct.com. And you can visit the website, the community website that I've already mentioned. And of course, never forget to follow us on social media at Access Health CT. Okay, so we're ready for some questions. Denise, I'm going to, there's been some questions that have been proposed in preparation for the webinar. And also we have one that one of our participants just shared with us. So let me read this question and we can tackle it. What information is available to the consumer about cost of treatment? If I needed a hip replacement, can I tell in advance what my cost would be for comparison shopping? And what the quality ratings is for the provider? For example, post-operative infection rate. You mentioned calling the pharmacy for prices. What about calling a hospital for prices of a hip replacement?
Hi, can you hear me?
Yes, we can hear you. Wonderful.
Okay, I've just taken myself off mute. I can't see who asked the question, so I want to say hi, whoever you are who asked the question. So I would answer it this way, and I'll share something intensely personal, but it's so relevant to this conversation, which is not 8 months ago, I had a total hip replacement and was experiencing this exact issue with cost. I've only been with Yukon for a little over a year. Hadn't had to use a lot of health services, so I hadn't had to use my insurance a great deal. And I had a number of questions on how this was going to impact my family finances. I started by talking with the doctor, so I just want to emphasize first that there is shared decision making and understanding the cost of the services that you're incurring. Doctors will not know a lot about cost. There's nowhere they can go in the electronic health record to pull up a cost of a particular service, depending on the hospital. But I think just in terms of the nature of the service itself and cost that the providers are aware of, I think that conversation should take place there. That's a really good place to start. But then I did two things because I have employer-sponsored insurance. I contacted my HR department and I asked a number of questions about my plan. And then I called my plan and I asked them very specific questions about the deductible, what that would be, about any additional out-of-pocket costs, about cost sharing, and what that might be for the procedure, and any additional costs, and had a lengthy conversation so that I could really understand what was the nature of the relationship. Now, I had already selected the hospital where I was going to have my care, so I had already assumed a certain quality because I've developed a relationship with a hospital when I need that type of service. So that is a distinct set of questions around where you're going to be accessing care related to the cost. Cost and quality are not easily linked in terms of going to a website and finding that, but more frequently you can begin to look at the specific provider and try to determine if you have to have the procedure and you don't have the specialist already. Again, that's why I say starting with a provider conversation, you want to find out what is the quality rating of that provider. Ask great questions about the procedure and how they approach it, how often they've done it, what their success is, and other questions related to your care.
Great. Thank you so much, Denise. I have another question. Actually, let me address it so that you know who is asking that question. His name is Jeff. So thank you so much, Jeff. And he shares with us that in his experience, the list of in-network providers are notoriously incomplete, inaccurate. What can we do to make this list up to date?
Yeah, I would not agree. I mean, excuse me, I would not disagree. And that's for whether you have a private coverage or a coverage through Husky. What could we do to fix it? You know, I guess what we could do is have some simple system that's completely integrated where a provider could just update their information, and then the health plan would automatically kick it out to everyone who has that health plan and has that coverage. But we're certainly not there yet in terms of sharing information and updating it in real time. You know, if you are selecting a provider, you know, sometimes people call their health plan and get a list of providers that are in the network. But always you want to contact that provider and verify that information is up to date before you make the appointment, before you consider. And there are many other questions to ask about a new provider if you're planning on developing a relationship. But of course, the financial aspects and whether that person is in network is critical.
Terrific. Thank you. Thank you so much. Let me switch gears a little bit and ask another question that I know has been shared with us before. And a lot of our community partners serve the population of families who are covered by Medicaid. And because Connecticut is a Medicaid expansion state, we have been able to provide increasing parts of the population coverage for Medicaid. But at the same time, we've gone through a couple of cycles where, due to budget considerations and such, some folks who were receiving Medicaid benefits have had to move to the qualified health plan part of insurance coverage. And the health insurance literacy at that point, I would imagine, becomes, quite critical. A family who is covered by Medicaid does not generally learn a lot of the terms and the types of qualities that are inherent in the private insurance market. Tell us a little bit about how you think we may be able to best reach that population, and what are some of the efforts that may be out there that worry about that part of the population, so that we can continue to make that effort as broad as possible.
Yeah, so as I'm sure all of us have watched, that eligibility be reduced year after year because of budget issues in our state. I know that Access Health would have more accurate information, or possibly DSS, on the number, but I remember hearing that up to 40% of the people who lost their coverage, their Husky coverage last year, never made it to the marketplace for whatever reason. They didn't know how to enroll. They thought they wouldn't be able to afford the coverage, or perhaps they had a technical literacy issue and they just tried to get on the portal and they just were not able to. I think a very important strategy, because we have another population of people who have been deemed ineligible. Ideally, we would be able to send out to community partners a list of those people in advance, so that we could better prepare people for what they do not know. Evelyn, you said it right. People do not know what they don't know. So they don't know what questions to ask. If they have never had to pay a premium, if they've never had a copay, if they've never considered their financial responsibility. There are many layers of issues that come about. How do I budget for the premium and the copay? Do I get a health savings account? How do I select a plan? What plan benefits are included? How do I know what I need? I mean, the questions are just mounting, and that's all just about really selecting the plan. That's not even really about using the plan. I know that our federally qualified health centers are excellent sources for people to go for information. They have certified application counselors around the state who are working full-time, who are available. Many of those CACs have been doing this work for years, and they're a great resource. But I encourage community partners to put out those flyers and to conduct that sort of outreach and ask people, did you receive a notice that said that you lost coverage? Are you confused? Are you without coverage? And there is help, and there is free assistance for you, so that people are not left out of the system and left out of access to the care they need to live a healthy life.
Terrific. Thank you. Thank you so much. We are nearing the time to end our webinar today, but I want to have a couple of more requests of our participants. Just now on the chat box, we've put up a link for a survey. It's a small, very short survey monkey set of questions to ask you about your feelings and your impressions of today's webinar. It's really important for Access Health Connecticut that we constantly improve on our services, our provision of information, and our education efforts across the community. So I would love for you to take a moment of your time and click on the link that is on the chat box and give us your impressions about today. Now, I'd like to close by giving a very, very special thank you to you, Denise, and the Institute, because you not only make great partners for Access Health Connecticut, but you educate us and help us reach so many more folks that really deserve to have this type of information in their toolbox. So I want to thank you for taking the time to join us today, for providing such a terrific presentation. And again, let me ask people to take a moment and do our Survey Monkey. And with that, I will say thanks again to all of you participants for taking the time to partake in this information today. We thank you on behalf of Access Health Connecticut, and Denise, again, thank you, thank you, thank you. This was a terrific presentation.
Thank you so much, everyone. Have a great day.
Terrific. And with that, we'll close today's webinar. Thank you so much.